lot of sleepless nights. I had a sciatic nerve pain from the lower part of my back all the way down to my ankle. When I couldn't sleep at night, it was impossible to lay down.
How long did you have that symptom?
Out of the question.
Yeah, how long did you have those symptoms?
Off and on since October.
Okay, so about 6-8 months actually.
Right.
We knew what your problem was. You had stenosis, you have scoliosis, you have listhesis, you had pretty bad spine.
Yep.
Now, you were offered already a surgery, is that correct? Tell me about it.
That is correct. It was Dr. I can't remember.
No, names don't matter.
I had two surgeons.
Yeah.
One was vascular, and one was a neurosurgeon.
Okay.
That were going to perform the surgery. And
what kind of surgery? Did they explain
the same surgery that I received from you, the spine or
fusion.
Excuse
yeah,
me.
but different technique, correct?
Different technique.
Tell me about it.
Same apparatus and hardware.
Yeah, same hardware. Yeah.
However, a much longer recovery time.
Yeah. What did they tell you about the surgery? What that surgery would entail?
They told me that I would get a bar in my L4, L3, L5 area, and some screws. And they said I'd be in the hospital for 3 to 4 days, roughly. No guarantee, it might be longer. And I'd be out. Pardon?
Yeah, go ahead.
I'd be out of work for, in my line of work, probably a good 6 months.
Okay. Now, how would they get those hardware in? How did they explain to you the details of the surgery?
Yes.
Because you said there was a vascular surgeon involved. Why would a vascular surgeon get involved in a spine surgery? Did they explain to you?
Yes, they were going to go through the front, and he was going to take and move all my organs over. You know, push all them and hold them over so the neurosurgeon could put the hardware in. I'm not really sure, from the front somehow.
Yeah.
And operate on me as the other surgeon held everything out of the way, my stomach.
Yeah.
And I don't remember what other organs, quite
well,
honestly.
everything important is in that area.
Yes.
This is called ALIF, or anterior lumbar interbody fusion. I'm well versed, I'm well trained to do that surgery, and I have done plenty of those surgeries. And certainly that is an option. The surgery is what you describe as an option, but just the fact opening up your belly and moving all your organ to the side is an invasive procedure by itself.
Right.
No, but you found me. Tell me about it.
It's amazing because I got up in the morning one morning when I already had the surgery set up, and I turned on my TV and I was going to make a cup of coffee, and I saw your infomercial.
Okay.
And I thought, I've never watched one before. And I watched it and I was just thrilled. I mean, here.
What thrilled you about that?
The recovery time.
Yeah.
The lack of hospital time, or the difference in hospital time, possibly none, up to a day, I believe it was.
Yeah.
And I could have been in as long as a week with the other technique, or the other procedure. But most of all, like I say, it would be the recovery time.
Recovery time, yeah.
Because I am ready to get back to life.
Yeah, no, your surgery was just yesterday.
Yes.
My part of the surgery was 53 minutes. Our blood loss was a little more than an ounce, which is really nothing for this kind of surgery. You already have walked, have you not?
Oh yes, I've been walking since I woke up and post-op.
And you told me that you had the pain in the leg that is different or gone now. Tell me about it.
It's not the shooting pain that I had. It's more like a stiffness from my back. But it does not shoot down the back of my leg.
Yeah, so that pain is gone now.
Oh, it's a miracle.
Plan for today is, doing physical therapy, teaching you certain action, and then letting you go home. Do you feel you are ready to go home?
Absolutely.
Excellent. Now.
And I said, I believe this is the way all of them are going to be done. I've had laser knee surgery.
Yeah.
I had my first open knee surgery was in 1973.
Okay.
And I was out of work for over a year.
Yeah.
Now that's a 3-week layoff for me.
Yeah.
So I think it's the way of the future.
Once we looked at the data, our blood loss is 1/10 of the open surgery. Our hospital stay is almost 3-4 days less than open surgery. But more importantly, we have farmers who go back to work within months. We have people who have been on narcotic for years. Within weeks, they come off narcotic and are able to resume their life. because we fix the problem without causing too much damage. The problem with the old-fashioned surgery, as you mentioned, is you have to either from the back literally fillet you open, or from the front, cut your belly open, push all the organs to the side, and that is invasive. That has consequences. Now, your example that, of a person who's informed, who is persistent, and at the end of the day, the whole system is about people like you, patient.